All right? Fine. Okay. Yes.
Can you tell us a little about yourself?
All right. My name is Tony, and I work as an eye doctor in a private clinic right now. The private clinic is at the Parklands Medi Plaza, which is opposite the Aga Khan Hospital. And I've just been here for about 9 months now.
How did you find yourself in this line of work?
I come from a family background of doctors. My grandfather was a doctor, my great-grandfather was a doctor, and my father is a doctor. So it was kind of expected as a family that I will be a doctor.
Did you need any qualifications, training, or experience for your job?
Biology would be a primary subject, of course, if you want to join the medical field. But then physics, chemistry, combinations would be the correct combinations to enter medical school. And then you do what is in some places would be called a pre-medical of 1 year. You join a medical school. Medical school is about 4.5 years. After that, you do a practical internship, which is 1 year. After that, you get the label of a doctor, and then you are a general doctor. So you work in a hospital somewhere, you do everything from seeing medicine, surgical cases, and so on. And from there, different people would specialize. Some would become surgeons, some would become physicians, some would become child doctors, some would become lady doctors, and so on. And that is where I decided that I wanted to become an eye doctor.
Please tell us what you do in a typical day.
Right now, the typical day would be I'm sitting in a clinic like this one. A patient walks in, he's asking for a checkup because he or she has got a red eye or a pain or is not able to see. So with the various equipment that I have in the clinic, this is like a microscope with a light which enables me to get the bigger picture of the eye. And then I have instruments that can enable me to see behind the eye. So combination of these. And then in the other room, we have a machine which does a couple of other tests, like if you need glasses, that machine can examine and do that. So after doing all the tests, then one can establish as to what kind of problem this patient has and be able to give either a prescription of glasses or medicine or advice about hygiene and stuff like that. So part of the oath that we take as when we become doctors is to keep on passing our skills. Teaching is a constant feature of being a doctor. You pass on your skills and you keep learning skills. So that's something that goes on all the time.
What is the best aspect of your job?
When an old lady, 65 years old, who has not seen for 15 years, she hasn't seen her grandchildren, she hasn't seen somebody who was born, gets sight after a surgery that I do, and the very next morning she looks at her grandchild and she's excited and that smile on her face gives me courage to go to another day.
What are the main challenges of your job?
Basically, being a doctor is a hard job. I mean, as I said, it's a lot of studying, right from the time you are in A school and there beyond. Yes, you can make money. It's not that you can't. But if you're only interested in the profession itself, it's not something that is going to give you tons of money straight away. But it's a lot of hard work. And you're playing with life, you're playing with somebody's sight. So you have to be within ethics, you've got to follow principles, and you cannot begin to do things on your own because this is something that has to be tried and well done all the time. Because if you make a mistake, the patient can go 6 feet down. As an eye doctor, you've got to have very steady hands, of course, because you are dealing with a very small eye when you're cutting and handling it. So you've got to, and they've got to be having a good eyesight. Like for example, when I use the microscope, I've got to have proper and full eyesight. And I've got to have both eyes because I've got to have the ability of binocular vision. So as an eye doctor, that becomes a specialty.
Looking into the future, do you have an overall career goal?
If I can continue working and I can continue teaching a bit, it'll be nice to see somebody who is, say, half my age coming to me to learn some of the skills that I may have picked up so that I can pass my skills on. That will feel nice.
What advice would you give anyone interested in your line of work?
If you work hard and if you aim to where you want to get to, there is nothing to keep you down.